Hello, my name is Lisa Smith, RN. I will be guiding you through the following procedures so that you may in turn better perform your job as an OR nurse or surgical technician. Aseptic technique in prepping in the operating room. Surgical skin preparation. Surgical skin preparation resource from AORN standards and recommended practices. Skin preparation rationale. Skin preparation rationale removes dirt and transient microbes from skin. It reduces resident microbial count in the shortest time, with the least amount of tissue irritation, which prevents rapid rebound growth of microbes. Remember, skin can never be sterilized. Skin preparation. Skin preparation factors considered: condition of area involved, number and kind of contaminants, characteristics of the skin to be disinfected, general physical condition of patient. Skin prep. Control of sources of infection. Skin prep. Control of sources of infection goal is to lower the amount of bacteria on skin. Incision site and area immediately surrounding should be as free of microorganisms as possible. Elements of skin preparation. Elements of skin preparation. Preoperative antiseptic showers. One night before and one in the morning before OR. Preoperative hair removal. Remove as little as possible with clippers. Immediate surgical site preparation in the operating room with surgeon choice of prep solutions. Elements of skin preparation. Preoperative hair removal. Clipping hair immediately before the surgery has shown a 1.8% SSI, surgical site infection, in comparison to 4.0% SSI, when clipping the night before. Using razors causes a higher incidence of skin irritation than clippers, as CIP measures require the use of clippers only in OR. Surgical site preparation. This should take place minutes before start of procedure. AORN states, condition of skin at the surgical site should be assessed prior to preparation for rashes, skin eruptions and abrasions. Skin should be free of contamination such as dirt, soil or other debris before skin preparation is initiated. Hair removal. If possible, hair is best left at the surgical site. Hair removal will depend on amount, location of incision and type of procedure to be performed. Preoperative hair removal has been associated with an increased risk of surgical site infection. Assess for rashes, moles, warts, skin breaks, other conditions at surgical site that might increase the chance of infection. Report any findings to the surgeon. Clippers are preferred method for hair removal. This will decrease potential for nicks, as well as decrease potential for infection. Clipping immediately before surgery, or as near as possible, is recommended. Copyright 3M Company used by permission depilatory requires a pretest to make sure patient is not sensitive. Shaving is not recommended because studies have shown a direct relationship with increase of infections. Hair removal should take place in a private place with good lighting. Avoid scratching, nicking or cutting skin. Cut hair as close to time of surgery as possible. To prevent dispersal of hair in the OR, hair removal should be performed outside the OR. Follow policies established by Facility Surgical Committee. Properties of antiseptic skin preparation. Products effectively cleans. Microbial count is reduced rapidly. Broad spectrum activity. Easy application. Non-irritating, non-toxic. Copyright 3M Company used by permission residual protection is provided. Antimicrobial agents. Idofurs, betadine scrub, betadine solution, betadine gel. Antimicrobial agents. Chlorhexidine gluconate 4%. Keep out of eyes, ears, and mouth. Apply product liberally to surgical site for at least 2 minutes. Dry with sterile towel. Apply product liberally a second time to surgical site for at least 2 minutes. Dry with sterile towel. May be used as a vaginal PrEP at CMC per Infection Control and OBGYN Advisory Committee for patients with betadine allergy. Watch patient for sensitivity to PrEP. Alcohol preparations, concentrations of 60 to 90% DuraPrep prevail. 1. Do not scrub. 2. Paint a single, uniform application and do not re-prep the area. 3. Do not allow to pool. 4. Avoid getting into hairy areas. Wet hair is flammable. 5. Allow to dry completely, minimum of 3 minutes on hairless skin, up to 1 hour in thick hair. Alcohol preparations. Concentrations of 60 to 90% ChloroPrep. 1. Start at the incision site and apply the solution in a back and forth or up and down motion for approximately 30 seconds. 2. Moist sites, for example, axilla, inguinal fold. Repeat back and forth strokes for 2 minutes. 3. Allow to completely dry before draping. 3 minutes. 4. Check for pooled solution. Do not blot. Use a gauze to absorb the solution. Guidelines to follow when prepping. Patients should be assessed for known allergies and sensitivities to PrEP solutions. An alternate solution may be chosen, if allergic. If patient is awake, give explanation. Avoid unnecessary exposure. PrEP should be performed using mechanical friction. PrEP begins at incision site and progresses outward to the periphery. Use a widening circular motion, not back and forth. Repeat several times. Length may vary from 1 minute to 10 minutes, depending on PrEP. Versant Advantage Incorporated, 2006. If a scrub is used, the area is blotted with a sterile towel. The towel is pulled out and away from the prepped area. Do not let the contaminated outer edges of the towel touch the prepped area. Apply antiseptic paint, betadine solution, over the prepped area. Sterile gloves and PrEP kits should be used. Versant Advantage Incorporated, 2006. Sponges or applicators used to prep an area are never reapplied to area previously prepped. Sponges or applicators should be discarded once the periphery of the prep area is reached. Do not allow PrEP solutions to pool under the patient, tourniquet cuff, or ESU, electrocautery bovie grounding pad. Folded or disposable towels shall be placed at the periphery area of the PrEP to absorb the excess PrEP fluid, prevent pooling and saturation of drapes. Dirtiest areas are always PrEP last. Always move from clean to dirty. Clean umbilicus separately with cotton tip applicators. If an open wound or body orifice is not part of the area to be prepped, then begin at incision site. If contaminated areas are included in PrEP, begin at surrounding skin area. If a colostomy is present, cover with gauze and/or sponge until surrounding area is prepped. PrEP last. Perineal area is prepped first with a separate PrEP kit so solution from a dirty area doesn't splash onto the clean PrEP. Abdominal and perineal preps are to be done sequentially, not consecutively. Shoulder prep axilla last. Unusual wounds and/or incision sites. Use nursing judgment to decide process that results in least amount of microorganisms at the incision site. If betadine gel is used, paint on, from cleanest to least clean, and let dry as much as possible. You only need a thin layer. DuraPrep, paint on, from cleanest to least clean, and let dry, do not let pool, contains alcohol. Several sponges are not provided in this type of prep. Apply once, never going back to same area twice. Use a second applicator if you need to go back for a missed area. Face and/or eye prep. Always prep both sides of the face for symmetry when doing the procedure. Use cotton balls with a non-irritating solution. Begin at nose, continuing toward cheeks. Use warm sterile water to rinse off solution. Do not allow solution to pool under patient's eye. Abdominal prep. Apply sterile gloves. Apply towels on periphery to prevent pooling. Use cotton tip applicators to clean umbilicus, dip in scrub solution prior to utilizing. Start at incision site with first sponge. Proceed to periphery. Repeat, if using a scrub solution, for example, betadine scrub. Blot with sterile towel, if using a paint after scrub, never reach over area, apply towel and remove toward you, blotting with gloved hand, using Aeseptic technique. If applying a paint solution, for example, betadine solution, start at incision site and proceed to periphery. Remove sterile towels at periphery, being careful not to contaminate prepped site. Patient is now ready to be draped for procedure. Extremity prep. An additional person or apparatus may be needed to hold the limb securely, so the entire limb can be prepped circumferentially. Have person holding limb don sterile gloves. A scrub brush may be utilized for hands and feet. Avoid irritating tender skin or scratching, portal of entry for bacteria. Scrub and/or paint. Don sterile gloves. Start at incision line and prep circumferentially. Blot if a scrub is used. Paint with solution, usually betadine, starting at the incision line. Prep feet or hands last, if not site of incision, do not get prep solution under the tourniquet. Alcohol prep. Don sterile gloves. Start at incision line and prep circumferentially. Documentation of skin prep. Assessment of skin at operative site. Hair removal, if performed, site, method, time and person performed. Patient allergies, if any. Site of prep. Prep agents utilized. Name of person performing prep. Allergic response, if any. My name is Lisa Smith. Thank you for being here today. I really appreciate that you took the time to watch my presentation. Once again, I would like to thank AORN for all of the invaluable information I used to put this presentation together. Have a good day.